Global Comparison of Social Policies, Family and Parental Leave. Family and parental leave is basically time off from work to care for newborns, children, and seriously ill parents, spouses, or self. Europe has been known to have excellent benefits when it comes to family and parental leave for both parents. The European Union, or EU, is a political and economic superpower made up of 27 countries located mostly in Europe. From the Principles, Countries, and History tab within the European Union.Europa website. The EU has a set minimum standard of 14 weeks of paid maternity leave. However, several EU countries offer over 30 weeks of paid maternity leave, as well as additional parental leave, paid paternity leave, and flexible work arrangements to support families, states Amantia et al. In their paper, Exploring Maternity Leave Policies in European Union Countries, 2025. For this presentation, we will focus on Denmark, as they are changing their parental leave policy beginning January 1, 2026. From Denmark Increases Parental Leave for Parents of Hospitalized Newborn Children, 2025. Denmark's Parental Leave Act, 2025. The new law was signed by the King of Denmark on June 20, 2025, and will start on January 1, 2026. Denmark will increase its government-paid leave for parents of hospitalized newborn children from a previous combined total of 3 months for both parents to now 12 months for each parent. The current leave is as follows: 2 weeks allocated to each parent to be taken immediately after the child's birth, but cannot be transferred to the other parent. 8 weeks allocated to the mother to be taken within the first 10 weeks of the child's birth, and allocated to the father or co-mother to be taken within 1 year of the child's birth. This may be transferred to the other parent. 9 weeks allocated to each parent to be taken within 1 year of the child's birth, but cannot be transferred to the other parent. And 5 weeks allocated to each parent to be taken within 1 year of the child's birth and may be transferred to the other parent. Slide information taken from Denmark Increases Parental Leave for Parents of Hospitalized Newborn Children, 2025. The United States of America has no federal paid parental leave law. We do, however, have the Family and Medical Leave Act, also known as FMLA. However, that is only for those who are eligible, which means the employer must be covered, the employee must be employed there for at least 12 months, and have worked 1,250 hours of work service, as well as working at a location where the company or agency has at least 50 employees within 75 miles. This is more protective leave for childbirth, adoption, or placement of a foster child, care for an employee's child, spouse, or parent with a serious medical condition, the employee's serious medical condition, or reasons pertaining to a family member's service in the military. Taken from the Department of Labor Fact Sheet number 28F. Value systems. The value systems in Denmark seem to place more emphasis on the people, more egalitarianism and classless, and not the government or big companies like the United States does, which is more materialism and economic classes. Taken from Health and Infrastructure in the US and Denmark, a comparison, 2025. The Denmark.dk website explains it simply. Citizens and private companies with higher incomes pay higher taxes, and citizens and private companies with lower incomes pay lower taxes, and that these taxes are used to finance the extensive healthcare and education services. 2025. In the US, the income gap between the wealthy and the working class has been growing excessively for more than 3 decades, according to inequality.org, 2025. This is likely due to tax breaks from investments that the working class cannot necessarily participate in due to lower wages and salaries. Welfare models and how they impact parent leave. In Denmark, it is more universal and better tax funded. Higher incomes pay higher taxes. Healthcare in general is more universal and more equally accessed by everyone. Childcare is subsidized from an early age, which aids equal incorporation of men and women back into the workforce. Taken from Welfare in Denmark, denmark.dk. In the United States, the welfare model is more lingering in terms of providing a minimal safety net, but also is supposed to be temporary. It is tax funded, but when major corporations and the wealthy receive tax breaks, the working class pays for it. Healthcare is more focused on private insurance, with government-based programs like Medicaid and Medicare for specific groups of people. Subsidized childcare is mainly for lower-income families to help improve child development. Schmidt et al., 2008. Commonalities and differences in parental leave policies. Commonalities. End goal, allowing parents time to bond and care for their baby or adopted child, which is important for health and brain development, as well as to adjust to new family roles. Timescale. Both countries allow for a substantial amount of time for leave. This can lower parental stress by allowing them to recover physically and emotionally, and it can also increase a father's involvement if he has time off and can take a more active role in caregiving. And shared leave. Both countries allow parents to share the leave time. Differences. Payment. Denmark has paid leave, mainly funded through their social welfare system and taxes. The U.S. has unpaid leave, no federal funding, and employees must typically use their sick and vacation time, if they have it, if they wish to be paid. FMLA is mainly for job protection. Coverage. Denmark allows for all parents to take advantage of the leave. The U.S. only allows for certain eligible employees to access leave. Therefore, parents who work in retail and food services may lose paychecks when they cannot work. Information taken from Paid Maternity Leave by Country, 2025 Employer Guide. My personal preference, Denmark. Why choose Denmark? 1, because of effectiveness. It can help build better bonds between parent and child, foster family nurturing, and can ultimately lead to worker retention. Inclusivity. All employees are eligible. They can ultimately build better work-life balance, and it can help minorities, single parents, and those less educated be able to afford to take more leave when necessary. Overall impact on society. This would likely promote more positive impact on early childhood development, which can ultimately impact educational and economic outcomes, and has the potential to reduce dependence on public assistance. Information taken from the Democratic staff of the Joint Economic Committee. Implementation, feasibility, and obstacles. Could paid parental leave for all, like Denmark, be realistically possible in the US? Yes, it is possible. However, many factors prohibit this from happening. Kristen Arneson, in her article, Why Doesn't the US Have Mandated Paid Maternity Leave?, states that the idea that providing universal paid parental leave could encourage the wrong families to reproduce. 2021. This makes me think of my clients who work in lower income and minimum wage jobs because they may be younger or less educated than others. Racism, sadly, plays a part in this as well, because there are still people who believe that if you help everyone, then you're also helping those who are not deemed as worthy, and those people may be of color. Policymakers disagree about possible structure of such a program, believing employers should be the ones to pay for it and not the taxpayers. Despite this, there are roughly 13 states that have passed paid FMLA laws, such as California, New York, Minnesota, and Maryland, to name a few. Williamson, 2025. Support for diverse populations. Denmark's parental leave policy is supportive of diverse populations. It recognizes non-biological parents, single parents, and LGBTQ+ families. Immigrants and foreign nationals, if they are a part of the workforce, are also entitled to the parental leave policy. Sharing of leave is essential for non-biological and LGBTQ families. Per the Duvander et al. Report, a major aspect of sustainability is to view challenges such as gender inequality, social inequalities, and labor market difficulties as interconnected. This is how changes are made. View the challenge as something to be interconnected and find the solution to fit the majority. Information taken from Duvander et al. Parental Leave in Denmark, Paid Parental Leave and Social Sustainability in Nordic Countries. Promotion of justice and diversity. Denmark's parental leave policy promotes social justice and honors diversity by covering all types of families, employees, and classes. Many things must change for the U.S. to overhaul its parental leave policies, welfare system, and more. In the Public Health Advocate article, Health and Infrastructure in the U.S. and Denmark, a comparison, it states, U.S. Senator Bernie Sanders uses Denmark as a prototype for how America could be if democratic socialism were to become a reality. He applauds how Denmark's foundation of economic security is conducive to happiness, and remarks that the deep-seated distrust in the American government is a core struggle facing the U.S. as a whole. Maisonneuve, 2016. It is also mentioned that Denmark, as a people and country, expectations and accessibility of services are better, and society is more solid and not fluctuating. The U.S. could look a lot better if we followed healthier role models. Consider this case study. Trinisha, a single mom of 3, ages newborn, 4 years, in 6 years, works at a local fast food chain restaurant, making $11.60 an hour. Mom works 35 hours a week and has been with the same company for 2 years. Mom is also in school working on a degree in human services so that she can better provide for her family. She was only able to take 3 weeks off from work after delivery because if she doesn't work, she doesn't get paid and she needs to support her kids. Her company does not have any benefits for sick, vacation, or parental leave. The 6-year-old is in kindergarten, the 4-year-old in NC pre-K, and the newborn is staying with the maternal grandmother because she's not old enough for childcare yet. Is mom entitled to FMLA through her employer? What other services can mom apply for to help her family? References.